consumers, you know, being in control and so forth. There's a person called Pat Corrigan, who's very well known in the stigma research. Some of you would know him. He made a very interesting comment about being invited to the table for consumers. He said, it's not a matter of being invited to the table, the consumers own the table. And I thought that was a very nice
They should, but they're not owning it.
They own it.
So does anybody want to address the question about the employer provided services versus the publicly funded services that was raised? Because in my view, I mean, I think a lot of people that do get sick in the workplace, you know, although a lot of companies do have the employee assistance plan, a lot of people do still access the publicly funded system, you know, a substantial number of people, I think.
My point is, and it goes back, I think, to Michael's early slide, is there's a very small percentage you can actually get access, especially if you're in the mild and moderate group.
Yeah,
choose that public service. So we along with employers have a shared interest in improving the employer-based response and how it integrates with the public system. And right now they operate as two very different.
Absolutely, and I think one of the recommendations of the task force, I think, is in fact for all employers, to start thinking about creating psychologically healthy workplaces, and also start thinking about, treatment options for these people, because the argument clearly is the amount of money that they might spend providing either prevention or treatment services would be much smaller than the costs that they incur for absenteeism, presenteeism, and those sorts of things. But let's take a question from you, and then we'll go to Tony.
The question isn't about workforce, but it's more along the lines of, like, we're talking about a paradigm shift, using more e-technologies and whatnot. I work for an agency that serves the deaf community, primarily deaf, hard of hearing, and deaf blind. And we had to, I'm relatively new with the position, so bear with me here, but the history is we had to fight tooth and nail such that we could use text messaging to communicate with clients. Because for deaf, they can't pick up the phone and call, right? So we managed to get that through Vancouver Coastal Health, and now I'm having a battle to get access to Skype, right? And I acknowledge that there's security issues and through the network system and whatnot, but I guess where I'm going with this is there is a paradigm shift, and as the comment was made over here, is a resistance to using technology, generally speaking. I'm talking primarily about Vancouver Coastal because that's been my experience. But in this room, it's very exciting to hear where we're going with this, and we're working on sort of revising our website for the well-being program. But then we're getting all this resistance and pushback as well, right? Oh no, we can't use Skype because it's not secure. Yeah. And then we think about empowering the community. I think of my community that I'm serving, that deaf, where it's visual, right? Empower them to use Skype. It's a great way to reach out to them, but I'm being blocked.
And often it seems to me that blocking occurs. People say they make assumptions about what a consumer may or may not want. A consumer that rings a crisis line has to be anonymous, for example. That was an assumption. And then we went in and we found out, we did a scoping study and found out that in exchange for actual extra services, they were more than happy to provide their names. So I think there's often an assumption about what consumers want without asking the consumer.
Exactly.
Just comment by saying, well said. I've had a similar kind of tear my hair out. What is the matter with Skype? Can't we just use Skype? And moving to any new technology, for heaven's sakes, video conferencing with Ministry of Health in Victoria is absolutely atrocious. I've lived through that for 2 or 3 years. I still have to go to a special booth in a boardroom and take up the whole boardroom to be, and then even then it doesn't work half the time. What is the matter with us? So IT has got a big agenda, but I think one of the things that's really held us back is, frankly, the privacy argument. In fact, it got so bad that a year and a half ago there was a mediation called between I think it was the Solicitor General's office and the Privacy Commissioner and Ministry of Health, all the ADMs, saying we have to have a mediated session to try and get through this. It was literally you guys are holding us up, we can't do anything. Now that didn't really open up the floodgates, as you already know, but it's just you know, it's just my own frustration, and I think it's everybody in this room. Privacy it's a big industry, right? And not to diminish in any way the respect that we have to provide for all of the people we look after, but it gets to be trotted out, I think, sometimes as a reason why we don't need to do that or we can't do that, and I would never accept that. We have to push through it, and we will push through it.
I think the ministry is probably getting the message, because recently they did a survey of all the health authorities to just get a sense of the extent of the health services at various health authorities, and I had a very quick look at the preliminary report, and it looks just terrible. I mean, I think, and I think people that they've contacted, and some of us did comment that, because of all these barriers in terms of, the administration saying you can't use Skype or you can't use, whatever, all the people want to use this because of those restrictions, people are not using. So I think they're getting a message that this is, we are way behind in terms of technology and we need to move forward. So it's likely that, that the timing may be right from our perspective to move forward.